Strategies by Heather Roberts. Strategies. Objectives of the project were to, goal number 1, determine the first term students who are at risk. Goal 2, implementation of learning strategies. Goal 3, assess outcomes. The problem statement, student persistence to graduation, early identification of students struggling early in the program. The gap is 6.5% from the national average of 70.5% graduation rate. This project aims to reduce the gap by working with identified students through lectures, clinicals, and labs. The number we need to stay under is 22 drops. The identified number at-risk students directly correlates to the retention metric. If we lose 22 students by graduation, we'll be at the same metric of 64% in retention. Outcomes achieved while completing the Better World project. Identification of at-risk students, implementation of just-in-time support, evaluation of student persistence from Term 1 to Term 2, Term 2 cohort outcomes. Leadership skills for this project: project planning, communication, assertiveness, integrity, being authentic, resourceful, collaborative, and having some cultural awareness. To help support my findings, the students are required for their program to take the ATI Fundamentals Assessment to help them identify where they are in relation to the expected outcomes. Level 3 is exceptional, Level 2 is expected, average, and Level 1 is below average, and they are at risk. While this assessment identifies 12 students, a few of the students at Level 1 were not identified as having a C+ but a higher grade, B or better. Of the 12, 9 were at C+ or below, consistent with their Level 1 result. 2 students with a Level 1 result that tested with accommodations scored a 48.7 and the other a 71.6. The 48.7 and the 51.9 did not continue with their program. One withdrew before failing the course, the other did not pass the course and will have to repeat it next year. The third drop, a second semester nursing student, decided not to become a nurse and changed degrees. The current cohort is now at 54 students, and we need not to lose any more students to stay greater than 38 students to succeed at the retention score greater than 64%. And we're on track to do that. The SWOT analysis was done to assess the program and the project to determine the strengths, weaknesses, opportunities for growth, and threats. Let's begin with strengths. The advantage of the program is that we have grant and funding. There's a wait list of students attempting to get into the nursing program. We're the only associate program in 60-mile radius of where I'm at where the project was completed. And people with years of experience in nursing education, we have them, and price and value of the program. Opportunities are areas to improve. We have to recognize our gaps. We have to recognize them and actually do something about them. We have to align our teaching methods to the program, use the ATI to its fullest ability, their resources, their assessments, their testing platform. We need to fully embrace it versus parts and pieces of it. We also have technology that we need to embrace. We are using Brightspace, and that needs to be more utilized along with Microsoft Teams and Microsoft's platform opportunities. Community partnerships is another area of opportunity. Weaknesses that we have identified in the program was not staying current with nursing practice. Faculty not knowing how to assess or use equipment becomes a gap in itself, and then also creates a problem in the clinical space where the students are then now using those skills that we've taught them. And if we've taught them wrong, then it shows up in the clinical environment. Gap in the capabilities of staff to work with different learners is also a problem. We have a very one-dimensional viewpoint. I lecture, you listen, and there's nothing in between. So we need to take that to a multidimensional level because we have different students who have different needs. We have the neurodivergent students, we have the students with some learning disabilities, we have the ADA concerns or cultural students that might not speak English as their first language. So we have to take our one-dimensional path and make it multidimensional. Leadership is absent. And I hate to bring that into light, but the direction of the leadership is not clear. We are not working as a unit, but as individuals in a box, almost like in a vacuum. Told however you want to teach a course and there's no real direction or consistency with how we're teaching courses, how we're using the platforms, how we're addressing things with students, it's all over the board. And that causes then greater consistency issues, and gaps turn into chasms, and we have now valleys that are miles deep because we can't get the consistency on board. That can cause in itself unhappiness with faculty, unhappiness with students, and then that then leads to possible drop rates and pass rate of NCLEX being low because we aren't all on the same page with our teaching abilities. The threats identified as loss of faculty and ability to sustain the program due to lack of faculty. We can't bring in new faculty if we're not teaching new practices and if we are continuing to hold on to old practice. And that leads to problems because if you're bringing in people to change the current situation and you're still holding on to old practices, those new people get basically isolated and frozen out and they don't stay. So that's something that we have to address. The political atmosphere on campus is old culture and practices versus new culture. I've heard it referred to as being the outsider, personally. So I think that is something that needs to be addressed because that never is welcoming to be referred to as the outsider in a nursing program that you're teaching in. So I think that says a lot there. And then the reputation in the community is damaged. If you're not willing to take in new thoughts and ideas and innovation and processes of how to do things, then that leads to a collapse of your program. And so that is my SWOT analysis of my project. Identify the SWOT analysis and our strengths, weaknesses, opportunities, and threats. Let me give my recommendations of the project and what I feel that we should be doing to continue to have a high retention rate and persistence to graduation, and my conclusion of the project. Acknowledge the gaps, cultivate a team, and consistency in instruction. That is really important. Individual people in a box, in a vacuum, doesn't really help cultivate a team or provide consistency. So we need to work on that. Our director needs to lead. Transformational and servant leadership, pick one, pick something else, but we need a leader that will lead and that inspires others to follow. Currently, that is not what happens because, as I just said, we're not working as a team. We are individuals doing our own thing, and however you want to do it is fine, is the message that's been put out repeatedly. So I think that is a problem in itself, and that comes down to probably the experience of the leader in place and not having a higher knowledge base and leadership skills and abilities. Embrace change. Don't talk about it, but do it. If we have had a problem going on for 4 years and it's still a problem 4 years later, and we know that we have to change it, then why haven't we changed it? We need to stop talking about change and actually implement a change, stand by it, and execute it. Training that is relevant. While I understand training is important in how platforms are updated and stuff like that, and policy updates, all important. I'm not knocking that at all. But we need to make sure that the staff and the faculty that are training and working with our students have all the same skill set, all at the same skill level, and that we are not teaching and saying things that are inconsistent with each other, because that causes confusion, and that also then leads to unsafe practices in the clinical setting. Don't settle for minimums, but strive for more. Acknowledge that every student is not the same. We're not a competency-based program where everyone is at the same level and they pass and move on to the next course and everyone's at the same level. That's not the case. You have students who excel. You have students who are just barely making it, And we have to acknowledge them and understand how to get everybody up to that same levels at the same minimal benchmark that we have. Then if people are not at that benchmark, then that's where we have to require and must require interventions for them to get to that standard. The nursing program, like I said, is not competency based, so therefore you cannot approach that all students are the same. Just because they passed this course prior does not mean that they all start out at the same level. And I think that's a huge misstep that our director is putting in place in our program. We are on a GPA system, and a base minimum of a seat is required to move on. Accountability. There is a difference between students and faculty, and we need to understand how we all play our parts in that system. The major part in retention of students comes down to the faculty's understanding of that role that they're playing, and also how do we elevate and give feedback when necessary to students that might not be pleasant. Having those crucial and critical conversations with students needs to happen, but then also leadership needs to support those interactions and not side with the student in fear of the student. I've seen that recently, and it's been very eye-opening how much power the students have at faculty. It's pretty impressive. So how are we not meeting the minimum standards should not be passing on a student. So if a student is not meeting that minimum, we should not be then bending the rules to allow that student to, they missed the question or missed it by a few, because once we start down that slippery path, then one student's like, well, you did it for her, but why not me? Well, because she has accommodations, or because of this, or because of that. That becomes a very slippery slope. And unfortunately, I've started to see that happen as well. So we need to stay at the minimum, and we need to make it very firm and concrete where we are with stuff. And finally, with that accountability, those crucial conversations, we just need to understand where the students are and then ask a series of questions of ourselves, faculty, and students. And I think those series of questions are really important. How did we fail them with instruction? We should ask that. We should all be able to acknowledge that or ask that of ourselves. Did we not teach them testing strategies? Did we not provide them resources to help them learn how to academically write? What did we do not to prepare them for their courses? Did they not put forth the effort from the student perspective? Did they not have school as a priority and work and life events were first, school last? If they were struggling, are they using tutors? Are they using the resources offered to assist them at the college? And then finally, I believe that these recommendations should be followed for retention and persistence strategies. These questions should be asked of both faculty and students. In the end, we all need to keep in mind nurses care for patients, they advocate, they protect, they provide medication, perform treatments, and having a comprehension of materials and pathophysiology and patient care is absolutely essential. We don't want subpar nurses out in the world treating patients, because that could lead then to the death of patients. And it's not like other professions where you can have an off day. Oh, I wasn't 100% today. Because the person who is on the other end of your off day could have a very serious sentinel event. I hope you all have a wonderful day. Thank you so much for your time and patience with this. And thank you.